Salam everyone. I am Raza and today my topic of presentation is phobias. After the tremendous explanation from my friends, now try to see the medical terminologies which here it is used. At the end you will have one quiz that the medical terminologies will be used there. So what is phobia? It is an anxiety disorder. The anxiety disorder, and it is an intense type of fear. The fear may be extreme, unreasonable, that it has no reason, and irrational, that it has no any logic. Then there are some types of phobia. Mainly I will explain three types of phobia. The first one is simple phobia, second one is agoraphobia, and third one is social phobia. Simple phobia. In this condition, the person will feel that he is powerless and he will avoid in contact with the objects he fears. Like if you don't like the company of spider, he will avoid spider. If you don't like jumps, he will avoid jumps. Same goes for snakes and darkness. And there are two subtypes of this phobia. One is hemophobia and other is aerophobia. Hemophobia, as the name indicates, hemo for blood, it is the fear of blood. And the other is aerophobia, it is fear of flight. Agoraphobia. Agoraphobia, it means the fear of marketplace or the fear of public places. Social places. And the person will afraid to leave the environment. Why? Because he thought that it is the most safest place. Like in severe condition, he cannot even leave his home. Why? Because he thought that he thinks like this is the most safest place. And the person cannot go shopping malls, elevators, like it is an enclosed place and it is congested. And other theaters, cinema, the person cannot go in this place. The third type is social phobia. It is the fear of social situations. Like the person feel that people will judge him. That's why it makes anxiety in that person which remains for week. And here the main important thing is he catastrophizes things like worst case scenarios. He thinks more than the problem which actually not exists, and thinks more than the problem which is the problem actually is. So he may be sweats or he trembles, heart rate may be increased. And there are some causes, but the main causes are unknown. Why? Because it is a multifactorial. There are a lot of factors which is controlling and which affecting. But I will explain some of his family members have one. If someone of his family has this disease or this phobia, it may likely to be transmitted in him. And the other is traumatic events. The traumatic events is that if he has bitten by a dog in the past, he may have fear of that dog in future. This is called traumatic event. Next time. Here are some subtypes like I already explained. Cynophobia is a fear of dog. Dentophobia is extreme fear and anxiety of dentist, like this. Next time. So, my next topic is obsessive compulsive disorders. Can anybody tell me what is OCD? No?
Someone is too obsessed with something.
Yes.
It can be washing hands, or it can be even obsession related to people. Like they cannot let go of something.
Yeah, you are right, exactly. Next slide. So I will try to explain it more. So it is also an anxiety disorder, and in this condition the people cannot maintain the relationship. Either it is the relationship of siblings or father, parents, or other relations. He cannot maintain it. And there is one example that I will explain both of these terms. What is obsessions and what is compulsions? Like before going to sleep, we check our main door of home, that it is locked or not. We check either the oven or gas is on or off. We check one time, it's good, it's normal. But if you check 2 times, 3 times, 4 times and more than this is abnormal condition, and this is the disorder. So in obsessions, the person will thought, and this thought creates one anxiety and some intrusive thoughts. This because of this he will take some action. Why? To reduce that anxiety. So obsession is the thought and compulsion is the action which he takes. Next slide please. And 3% of population have OCD. Some have only one, like only obsession or compulsion. It depends. And there are other examples, like if he see any germs, he will go and clean it. And if he thought that it is unsafe, he will go and check recurrently. And if something is not arranged, he starts arranging. These are the obsession that it creating some anxiety in that person. Okay, and compulsions are the actions which he is taking just to reduce that anxiety. So the person will do mental rituals. So what is mental rituals is that he will try to replace the bad thoughts which is continuously coming in his mind with good thoughts, just to get rid of that anxiety. So mental rituals, and it creates distress in mind. How? That if he have to reach somewhere, it will take 20 minutes, or means it will take 1 hour to polish his shoes, or to dress up, or to fold his clothes. Because of that, he cannot reach at that place on time. This is the main problem. And there are a lot of treatment, but I will explain two of them, like psychotherapy and selective serotonin reuptake inhibitors. Psychotherapy is just talk therapy. It is in this, psychotherapists will talk with that person and try to understand what is the problem, what is the person is thinking about it. He identify the problem and say that it is not the problem, and maybe it can be cured. But in the SSRIs, it is, as we all know, that serotonin controls mood, anxiety and stress. So what it does is serotonin, selective serotonin reuptake inhibitors, then after serotonin release in the synaptic cleft, it will not be reuptake. So it will accumulate in the blood and brain can easily use it. So it regulates the mood. Next slide. There are different types of OCD, like contamination, superstitious, perfectionism, relationship, and there are some symptoms which I already explained: repeated thoughts about contamination, fear of losing control, etc. Next. So my next topic is mood disorder. Mood disorder, it may be severely depressed or may be manic or widely elated. This is called mood disorders. I will now explain it thoroughly.
What is depression?
Yeah. Can anybody tell me what is depression? You all know.
What is depression? I think it's a state where, I don't know, but it's when the brain is not able to
Yeah.
okay, when the body, I don't know, the brain cannot produce enough serotonin.
Yeah,
So
it's
hard
one of
for
the
it
cause.
to produce serotonin.
Yeah,
So
this
it's
is.
always hard for the brain to compensate for that experiences, something like this.
Thank you very much. Next slide. Depression is in this depression, people cannot enjoy interest and pleasures, and it lasts for a long time. There are some types like unipolar and bipolar. Unipolar is also called major depression, and bipolar is called minor depression. And women have 20% and men affect 12%. Women are likely to affect twice as men by depression. And I have a question for you people. If someone answered to this question, I will clap for that person. So try to focus. Why women are more likely to suffer from depression than men?
They are more sensitive.
Yeah, why?
Because they are more sensitive.
Why? What is the reason? You are right, but what is the reason behind it?
Because of changes in the
What?
because of limbic system.
They tend to think more emotionally.
Yeah.
Whereas men are logical, so women are more prone to
Yeah. Please listen. Rasti, you can tell. What?
Girls are getting things so serious sometimes than women.
Yeah, why? What is the reason? Yes.
Because of some hormonal changes during pregnancy.
Yes, this
during
is. Okay, you're right. So clap for Sabir, please.
About signs and symptoms of depression and
Yes. So first reason is that hormonal changes. During pregnancy, the estrogen and progesterone hormone controls the secretion of serotonin. As I already explained, what is the role of serotonin, and it regulates the mood. And the second one is that after delivery, a woman is like caregiver to her child. So she is sensitive about her child. It creates depression. And the third one is that the structure of mind, the woman brain has larger hippocampus. So as we know that it is controls what? Emotions. That's why women are more prone to this. Please next slide. Unipolar disorder. It is also called major depression, and its causes are multifactorial, like genetic and biological. Family members are 3 times more at risk, and biologically due to imbalance of neurotransmitters as serotonin, norepinephrine, dopamine. These are all controlling the mood of any person. So the major role here is serotonin. Why? Because it controls the secretion of other hormones, and it has a major role. And people also can take antidepressants. And environmental factors are due to death in family. What does it mean? That if anyone in his family has died, that it will affect on his mental health, and so it may be the cause of depression. Next slide. So there are symptoms. Symptoms are depressed mood, feel less pleasure or interest, weight loss, inability to sleep or oversleep, and suicidal thoughts, and maybe they do suicidal attempts. And here the most important one is anhedonia. It is the loss of ability to experience joy in response to most joyous conditions. The person cannot experience joy. There are some subtypes of depression, like postpartum depression, the depression after delivery, and peripartum, the depression before delivery, or atypical depression. It improves mood when undergoes activity. It is contrary to the anhedonia. In this condition, the person can enjoy in joyous situation, like in birthday party or in someone's marriage. The person can enjoy. There are some treatments here with the intervention of medicine and without the intervention. Pharmacologic and non-pharmacologic. Pharmacologic is like the previous one, serotonin reuptake inhibitors, and the non-pharmacologic are physical activity. What physical activity do is, when we do physical activity, the neurotransmitter will increase, mainly serotonin. So it will regulate our mood. The second one is diet. If we use more fruits and vegetables, our immune system will work, and then also it has positive effect on depression. Psychotherapy is just the talk therapy I explained. And if a person gets love from his family or friends, or if he has good social relationships and interaction, it may decrease depression. Next. And bipolar depression. A bipolar disorder is also called mania, and it is a shift in emotions and mood and energy. On the contrary, in unipolar, what we said is we only remain depressed or sad. But in this condition, we have both the cases. Like unipolar, it has symptoms like the before, too little eating or sleeping. But in mania, person feels energetic and overly happy. That if he gets some money, he tries to invest in all the money in one business only, and he thinks that he has some supernatural power, and he becomes euphoric. What is euphoric? Intense excitement and high self-esteem. Next slide. Now I will explain this bipolar and unipolar in one graph. The midline, from the midline to above, it signifies what? Happiness. Next. So the causes is also multifactorial, genetic and environment, but family has more role here. And treatments are like the previous ones, serotonin reuptake inhibitors, and lithium salt is the main drug here. What is the role of lithium salt? It is a mood stabilizer. But here is one condition, that if you take lithium salt, you must have to get one other medicine. Why? Because it has some side effects which must be compensated. And talk therapy will not work here. Why? Psychotherapy will not work. Because in this condition, we will feel both the condition, that we are happy and sad. But in the previous condition, we were sad. That's why the person can identify the problem, what is going in his mind. We can search about it and we can find a solution. But here he is talking too much in many conditions. That's why it will not work. Next. Okay. Thank you very much for your attention.